Myasthenia gravis versus multiple sclerosis. NCLEX key differences. Hey nurses! Today, let's quickly break down myasthenia gravis versus multiple sclerosis, a common NCLEX comparison. Myasthenia gravis, autoimmune disease that affects the neuromuscular junction. Causes muscle weakness, especially the eyes, face, and throat. Gets worse with activity, better with rest. Watch out for myasthenic crisis, a medical emergency due to respiratory muscle weakness. Treated with pyridostigmine, steroids, IVIG, multiple sclerosis. Autoimmune disease affecting the central nervous system. Causes numbness, spasticity, vision problems, and fatigue. Has a relapsing remitting pattern or can be progressive. Managed with immunomodulators like interferon beta. NCLEX tip. MG equals fluctuating weakness, MS equals permanent spasticity and sensory issues. Clinical scenario. A 29-year-old female presents to the neurology clinic with complaints of double vision, fatigue, difficulty swallowing, and weakness that worsens by the evening. On examination, her reflexes are normal and no sensory deficits are noted. She has a history of similar episodes relieved with rest. The neurologist suspects myasthenia gravis. A week later, another 35-year-old female presents with numbness in her legs, unsteady gait, and blurred vision. MRI reveals demyelinating lesions in the brain and spinal cord. The neurologist diagnoses her with multiple sclerosis. Question 1. Highlight the findings that support a diagnosis of myasthenia gravis. Patient 1 note, double vision, fatigue worsens in the evening, decreased reflexes. Normal sensation, muscle weakness relieved by rest, positive Babinski reflex. Correct highlights. Double vision, fatigue worsens in the evening. Muscle weakness relieved by rest, normal sensation. Question 2. Drag and drop. Match each symptom or diagnostic to the correct disorder. Item MG or MS. Demyelination on MRI improves with rest, positive tensilon test, spasticity and numbness. Ptosis and diplopia. Correct matching. Demyelination on MRI gives MS, improves with rest, gives MG, positive tensilon test gives MG, spasticity and numbness gives MS, ptosis and diplopia gives MG. Question 3. Multiple response. Which nursing interventions are appropriate for a patient in a myasthenic crisis? Select all that apply and monitor respiratory rate and oxygen saturation. B. Administer pyridostigmine as prescribed. C. Encourage activity to reduce stiffness. D. Prepare for intubation if respiratory failure occurs. E. Administer high-dose corticosteroids. F. Place patient in supine position without support. Correct answers. A. Monitor respiratory rate and oxygen saturation. B. Administer pyridostigmine as prescribed. D. Prepare for intubation if respiratory failure occurs. E. Administer high-dose corticosteroids. Question 4. Clinical judgment. Based on both patients, which signs best differentiate MG from MS? A vision problems only. B. Weakness that improves with rest versus persistent symptoms. C. Presence of seizures. D. Sensory loss in upper limbs only. Correct answer. B. Weakness that improves with rest versus persistent symptoms. Thanks for watching. If you enjoyed the video, don't forget to like, comment, and subscribe. Your support means a lot.